You know that specific low-level panic that sets in when you're staring at a PDF of lab results?
Oh, I know it well. That distinct sinking feeling.
Right. You've downloaded it from some patient portal you barely remember the password for.
You probably had to reset it 3 times just to get in.
Exactly. You finally get the file open, you're looking at these rows of numbers, and there's a tiny little flag next to one of them. Maybe your absolute neutrophils are, zero point 0.1 off the reference range.
And you don't even know what a neutrophil is.
Not a clue. But you know that flag is red, and your brain just spirals.
It's the classic Dr. Google moment. You search for one symptom, one little acronym, and suddenly, according to the internet, you have about 3 days to live.
Totally. It's just this overload of information with none of the context. It's data without the story. And that brings us to exactly what we're unpacking today. It is January 24th, 2026, and OpenAI has just announced something that might finally bridge that gap.
The gap between I have a terrifying PDF and I actually understand what's happening in my body.
Exactly. It's called ChatGPT Health.
And this is a really significant pivot. We aren't just talking about, a new update or a slightly smarter chatbot that can recite WebMD articles back at you.
Right.
This is a dedicated product experience designed specifically for health and wellness. And what I found most fascinating in the launch materials is that they didn't just build this because they thought it would be a cool tech demo.
No.
They built it because the behavior was already happening on a massive, massive scale.
That was the stat that really jumped out at me. I think we all kind of assumed people were using AI for health questions, but the scale is just staggering.
It really is. OpenAI revealed that even before this dedicated version existed, 230 million people globally were using ChatGPT for health-related queries.
Every single week?
Every single week.
That's 250 million people.
250 million people acting as their own, medical detectives, asking about symptoms, trying to build workout routines, asking about that weird rash on their arm, all in the standard interface.
Which is terrifying when you think about it, because they were doing that in the same tool they used to write code or generate emails or, come up with fantasy football team names.
Exactly. So the mission here isn't trying to invent a new behavior. It's about retrofitting safety onto something humanity is already doing.
It's moving from rogue use to intended use.
Precisely. And when you move to intended use, you have to completely change the architecture.
Okay, so let's get into the nuts and bolts of that.
Yeah.
If I open up ChatGPT today, assuming I'm lucky enough to get off the wait list, which we'll get to, what makes this health experience different? Is it just like a new menu option?
No, and this is where it gets really interesting. The announcement is very specific. It's not just a mode like switching to dark mode.
Okay.
It is a dedicated space. You need to think of it as a completely separate room inside the house of ChatGPT.
Okay, let's unpack that separate room idea.
Yeah.
Because the biggest fear everyone has, and I mean everyone, is privacy. Nobody wants their therapy notes or their blood test results being used to train the next version of GPT so it can write better poetry for someone else.
Right, and that fear is the primary design constraint of this whole thing. They describe the architecture using a concept that I think is really helpful, a one-way mirror.
A one-way mirror. How does that work in software?
So imagine you're standing inside this health space. The AI can see out into your general life context if it needs to.
Okay.
For example, if you mentioned in normal chat last week that you just moved to a new city, or you changed jobs, or you're training for a marathon.
The life stuff, the context of who I am.
Exactly. The health AI can use that context to make its advice more relevant. It might understand that your stress levels are up because of the move.
So it doesn't immediately jump to some scary neurological condition.
Right. It pulls that context in to give you a better, more grounded answer.
Okay, that makes sense. Useful context import. But what about the other direction?
And that's the crucial part. The mirror is reflective on the other side. The data never flows the other way.
So nothing.
Nothing you put into the health space. No medical records, no conversations about your medication, no memories the AI forms about your health ever flows back out to the main chat.
So if I'm in the main chat asking for, a recipe for a dinner party, it won't accidentally blurt out something about my cholesterol medication.
Exactly. It's compartmentalized. It prevents that leakage. It's a firewall.
And the training data, because that's the other third rail.
Yeah.
Is OpenAI reading my lab results to make GPT-6 smarter?
In this case, that is the hard line in the sand. The source material is explicit. Conversations in health are not used to train OpenAI's foundation models.
So it's a sterile environment.
In that sense, yes, your data stays in the room.
That's, well, I won't say a huge relief, but I feel like we should remain a little skeptical. Privacy is a word that gets thrown around a lot in tech.
You should be skeptical. Skepticism is healthy, but the architecture here, the actual isolation of the environment, seems to be their answer to that. It's not just a policy promise, it's a structural separation.
Okay, so we have this secure room, the walls are thick, but a secure room is only useful if there's something inside it. The other big piece of this announcement is integration, right? Because honestly, if it's just me typing my symptoms in manually, I'm probably going to make a mistake. I might type hyperthyroid when I mean hypothyroid.
And get completely wrong advice. This is where we move from generic AI to grounded AI.
Grounded. I like that.
The problem with a standard chatbot is that it gives you the average answer for the average human. You ask about fatigue, it gives you the textbook list.
But I'm not the average human. I have a specific history, specific meds.
Exactly. And you usually have that data scattered across a dozen different places. ChatGPT Health lets you securely connect real-world data sources to ground the AI's answers in your reality.
We're talking actual medical records here, right?
We are. In the U.S., they've partnered with a network called Be Well.
Be well. I'm not familiar.
You might not be if you're not in the industry, but they act as a pipe. It lets users connect directly to provider portals. Think MyChart, hospital systems, insurance payers.
So instead of me trying to interpret my lab results for the AI, hey, my ferritin is 30. Is that bad?
Yeah.
It can actually read the results directly from the source.
If you grant it permission, yes. It ingests the raw data. It sees the history, the trends, the doctor's notes, the stuff you might have missed.
That is wild. And it's not just the clinical stuff, right? I saw a whole list of integrations for the lifestyle side.
Yes, and this is where the wellness part really comes in.
Yeah.
It connects with Apple Health on iOS, so it can see your sleep, your steps, your heart rate variability.
Okay.
It links with Function for those deep dive labs, MyFitnessPal for nutrition, even Weight Watchers.
That Weight Watchers integration was interesting. They mentioned GLP-1 specifically, which feels very of the moment.
It is, and it's a great example of how this synthesis works. Because right now, managing a GLP-1 protocol like Ozempic is a logistical nightmare for a lot of people.
It's a full-time job.
Right. So imagine you connect Weight Watchers. You get meal ideas that fit that specific protocol. But then, and this is the kicker, you can use an Instacart integration to turn that meal plan into a shopping list instantly.
See, that's the aha moment for me. It's connecting the dots. Usually, my step count is in one app, my diet is in another, my doctor's notes are in a portal I can't open, and my shopping list is on a sticky note. This puts them all in one conversation.
It is the synthesis of scattered portals. You can ask things like, how is my cholesterol trending over the last 3 years? Or summarize my latest blood work. It does the heavy lifting.
I love the idea of finding a hike via AllTrails based on my actual fitness level from Apple Health.
Right.
That feels like technology actually working for me, not just nagging me to close my rings.
It changes the dynamic from just tracking to doing. It takes the data and makes it actionable.
But, and I have to play devil's advocate here,
Yeah.
we all know AI hallucinates. It just makes things up.
It certainly can.
And when we're talking about health, making things up isn't funny. It's dangerous. How do we trust this thing not to tell me to eat rocks or ignore a heart attack?
That is the most important question. And honestly, reading through their process, it seems like OpenAI knew that was the first thing critics would ask.
Okay, so how do they build it?
With physicians, a lot of them. They collaborated with over 260 physicians across 60 countries and 30 specialties. And this wasn't a quick consult. This was a 2-year process.
2 years. So they were working on this way back before GPT-4o was even a thing.
Correct. And during that time, these doctors provided feedback on model outputs over 600,000 times.
600,000 data points of doctor feedback. That's comprehensive. But what were they actually testing? Because passing a medical licensing exam isn't the same as treating a patient.
You hit the nail on the head. Passing an exam is about fact retrieval. Being a doctor is about judgment. So they developed a specific evaluation framework called HealthBench. And this is fascinating because typically we test AI for accuracy. Did it get the fact right? HealthBench tests for bedside manner.
Bedside manner. For a robot, that sounds almost contradictory.
In a way. But think about what makes a safe medical interaction. It evaluates safety, clarity, and crucially appropriate escalation.
So it knows when to stop talking.
It knows when to say, You need to see a doctor right now. It's not just a disclaimer at the bottom, it's about tone. Does it communicate clearly without oversimplifying? Does it avoid using alarmist language?
It's designed to mirror how a clinician judges quality, not just how a computer scientist judges data retrieval.
Exactly. And the source material is very clear. This is designed to support clinicians, not replace them.
That is the red line they draw over and over again. It's not for diagnosis.
No, it's for preparation and navigation. The goal is that when you do walk into that doctor's office, you aren't spending the first 10 minutes trying to remember when your symptoms started.
Or scrolling through your phone trying to find that one photo of the rash.
Right. You have a summary. You have clear questions. You are prepared. You are effectively acting as your own case manager.
Okay, let's talk about the fine print. Because even with the one-way mirror, I know someone listening is thinking, what if I change my mind?
The off switch.
Yeah, what if I connect my Apple Health data and then decide, you know what, this feels too intimate, I want out?
The controls are actually quite granular. You aren't locking yourself in. The documentation says you can disconnect an app or a medical record at any time, and the access is lost immediately.
Immediately. It doesn't linger in a cache somewhere.
According to the docs, once you disconnect, it loses access. It doesn't retain the raw data. And you also have control over the memories.
The memories.
Yeah. You know how ChatGPT has memory now, where it remembers details about you?
Mm-hmm.
In health, if the AI remembers you broke your ankle in 2024 and you don't want it to, you can go in and delete that specific memory without wiping the whole history.
That's good. So it's not an all-or-nothing nuclear option. I can kind of curate what it knows about me.
Exactly. And they also mention purpose-built encryption and isolation for this specific environment.
A higher standard of security.
Yes, reflecting the sensitivity of the data. And for the apps you connect, they only collect the minimum data needed. There's a whole vetting process.
So it's a walled garden, essentially.
A very carefully tended walled garden.
Okay, so I'm sold on the concept. Or at least I'm curious enough to want to poke around. Can I go download it right now?
Well, that depends. First, are you on the wait list?
The dreaded wait list. The velvet rope of the tech world.
Yes, it is currently a waitlist system. And initially, it's rolling out to users on the Plus, Pro, and Team plans, so paid users.
And geography matters too, doesn't it?
It does. Currently, users in the European Economic Area, Switzerland, and the UK are excluded.
That makes sense given GDPR and health data regulations in Europe. That's a regulatory minefield.
Absolutely. They need to prove it works and that the privacy walls hold up before they tackle that. But for those who can access it, this feels like a coming soon feature that actually signals a massive shift.
It really does. For years, we've been talking about digital health, which usually just meant health info's on a computer now.
Or here's a PDF you can't edit.
Right. But this is different. This is active. It's not a file cabinet. It's an assistant.
Exactly. If we look at the three pillars we've discussed, a secure, isolated space, connecting real data like Be Well and Apple Health, and that physician-led safety design with HealthBench, it creates a very sturdy tripod.
It moves us from searching, which is active and stressful, to navigating, which implies you have a map and a compass.
And a guide.
And a guide. So here's where I want to leave us today. We've talked about the tech, the privacy, the data, but what about the human element?
Go on.
If this works, if patients actually start showing up to appointments with summarized trends, with their blood work analyzed, with a clear list of questions, how does that change the actual doctor visit?
That is the provocative question. The average doctor visit is, what, 15 minutes?
If you're lucky. And half the time, the doctor's just staring at his screen, clicking boxes.
Exactly. And 10 minutes of that is just information gathering. How have you been? What meds are you on?
You're scrambling to remember dates, trying to recall if the pain started Tuesday or Thursday. It's chaotic.
But if you walk in and that information gathering is already done, synthesized, visualized, and ready, what do you do with those 15 minutes?
You might actually get to talk about health.
You might get to talk about strategy, about nuance, about the stuff a machine can't capture.
It could potentially save the doctor-patient relationship by outsourcing the bureaucracy to the AI.
And here's the flip side. It could overwhelm doctors with patients who think they know everything because the chatbot told them so.
Right. Well, ChatGPT says my cortisol is high, so I need this specific test.
I'm sorry, doctor, but the robot disagrees with you. It's going to be a fascinating friction to watch unfold. The power dynamic is shifting.
A friction, but maybe a productive one. It's a brave new world for our medical records, and it sounds like for the first time, we might actually be able to read them. Thanks for diving in with us.
Always a pleasure.